Okay, now time to look at the place of alcohol and drug abuse in this country. Where are we? How's the fight going? To tell us more is Dr. William Okedi. He is the CEO NACADA, that is National Authority for the Campaign Against Alcohol and Drug Abuse. Welcome to the Power Breakfast Show. Of course, you assumed office back in 2012. It's just been about a year or so. What are some of the things that you have done that you would say, you know what, so far this is what we've done and it is very tangible on the ground?
Thank you very much. Over the past 1 year, we have done a number of issues. First is to look at the institution itself, because as an institution, NACADA requires to have the capacity to address the mandate that has been given. And towards that, we have reviewed the requirements. We have put in place an institutional framework and looked at the kind of capacity we require in terms of personnel. And we are now in the process of recruiting. If I tell you, for example, in terms of the senior personnel that are required to provide strategic leadership, there is really very limited capacity. So we are in the process of now recruiting about 4 directors to be responsible for the key programmatic areas: education and awareness, treatment and rehabilitation, research and policy, as well as ensuring that we support the supply separation through legislative framework. That is one. Secondly, we have, for the first time, been able to support civil society organizations. That is, out of the funds that were allocated to NACADA this financial year, we have allocated 300 million shillings to support the work of district alcoholic regulation committees so that they can undertake the enforcement of the Alcoholic Control Act. We have also allocated 100 million shillings to civil society organizations to ensure that the campaign is not just at the national level, but that in each of the districts in this country, we have civil society organizations that can go from at least house to house to educate the people about the dangers of alcohol and drugs in our country. Thirdly, we have strengthened our partnerships, particularly with institutions that reach out to the youth and reach out to the young people. For example, we now have very specialized partnerships with the PCA Church. We have very specialized relationship with the ACK Church. We have had discussions with the National Youth Service, the director of the National Youth Service, so that we can strengthen our relationships with the National Youth Service that has over 50,000 young people across the country. We are also working closely with the Scouts Association, and both to address challenges among the Boy Scouts as well as the Girl Guides. Finally, we are working with the stakeholders within the field of alcohol and drug abuse to address issues of the policy and legislative framework. We have a number of legislative weaknesses. For example, for a long time, this country did not even have a national policy on alcohol and drugs. We have now developed that over the last 1 year that I've been in office. We have also developed for the first time the national strategy to address alcohol and drug abuse. We have as well reviewed the Narcotics and Psychotropic Substances Act, because the policy was not in place. We now have a policy. We are moving to address the issues of treatment and rehabilitation facilities. For a long time, treatment and rehabilitation facilities in this country were not regulated. we now have developed regulations to ensure that these facilities are licensed and that they offer quality services, because it has been a source of concern. Thirdly, related to treatment and rehabilitation, if you look across the country, we have had a shortage of these facilities. 95% of the facilities are privately owned. Access to services, both in terms of access to actual physical facilities as well as affordability, has been a major issue. We have engaged with the insurance companies, health insurance companies, to ensure that addiction is treated as any other disease and that it is covered within the insurance policies. The National Hospital Insurance Fund is doing that, is taken that on board. We still are engaging with other insurance companies to ensure this is done. So broadly, this is some of the issues that we have been addressing and we continue to address.
Right. According to a recent report by NACADA, there was a drop in the use of drugs from 48.3% in 2007 to 31.1% in 2012. Good news. But then there was a slight increase in the use of narcotics such as hashish, cocaine and heroin, and a further upsurge in the use of bang among the youth. Are we really winning?
Even that statistic, that reduction. How can we trust that statistic?
Right.
I mean, if you look around, what has reduced?
I think it is important that we as Kenyans, and including yourselves,
yes,
trust that these statistics are real, because they are not just done by NACADA, but this research is done in collaboration with the universities and with the United Nations agencies, including World Health Organization, UNICEF, UNODC, and so on. So it is real. And we, I think, affirm that there is a reduction, because the statistics that we are sharing with you are comparing the similar survey done in 2007 and repeated in 2012. And that's the reality. Of course, there is the question: why is that? If that's the case, what is happening? And I think that there are a number of factors to this. The awareness campaigns that have been going on for a long time by NACADA, even before I assumed this position, have, I think, been awakening people. Secondly, the Alcoholic Control Act of 2010 did introduce some specific limitations to access to alcohol, and also ensuring that young people do not access this. So there are a number of reasons why this is the case. But coming back as to why the increase in narcotics and so on, again, I think it is important to say here, and I think this is always a misconception about what the role of NACADA is. In totality, NACADA's role focuses on issues of demand reduction, and that includes creating awareness, includes ensuring that the legislative framework is in place, and so on. But we have a challenge in this country in terms of enforcement. And for us as NACADA, and I think the country as a whole, we are extremely, extremely appreciative of the directive by the President that the enforcement agencies take it very seriously to ensure that enforcement of the law takes place. And therefore, we are optimistic that what we are seeing in terms of the narcotic and the increase will go down. Most of the cannabis is coming across our borders. It comes from Tanzania, comes from Uganda, and so on and so on. And I think
it's grown in Mount Kenya.
It is grown in Mount Kenya, and of course in parts of Western Kenya. Now, I think that the issue really is, on the one hand, enforcement of the law. And that has been a major issue, unlike other issues.
Dr. What
Yes.
changed the enforcement? When you're talking about enforcement,
yes,
you're talking about the chief. the assistant chief, the police, the AP. Those are major beneficiaries of the abuse. Regularly, you'll see. In fact, if anybody tries to control, it's kinamamas are the ones demonstrating in the streets. When it comes to the chief and the police, they continually protect. They continually get money from the sellers. So, in fact, enforcement is not there.
In fact, there's a question here from Dakalu David. Says, you cannot contain alcohol and drug abuse unless you sensitize the police. The Kenya police is the greatest problem.
Yeah.
Thank you. And it's good that this issue is coming up. At the conference yesterday, Senior Assistant Commissioner of Police, Mr. Karaba, was confronted with this same question. And the reality is that within the context of this country, a context that is really characterized by corruption and other deals, not just with regard to drugs and so on. The issue of corruption, not only just among the police, but I think amongst other law enforcement, including, for example, the KRA. We have officers who are supposed to be assisting in identifying this, including in amongst the public health and so on and so on. So I think it is a bigger problem. It is true that we have corrupt policemen, we have corrupt people in the district alcoholic regulation committees and so on. And that's why I think this is now a new chapter for us. We should move forward and ensure that as ordinary people, as ordinary Kenyans, where alcoholic drinks outlets do not meet the requirements, where narcotics or cannabis is being ferried, and we know that it is involving civil servants. The president again was very harsh to all of us yesterday when he spoke about corruption. I think it is now is the time, now that we have a political leadership that is categorical on these issues. As you know already, some of the kingpins of the narcotic drug and who have been bringing it in have been deported. And I think that it now is our responsibility to look back and to ensure that enforcement takes place. I think and that now that the county governments, because drugs and alcohol are now devolved to the county governments, and I think the governors that have met so far are determined to deal with this issue. And I think that it is an opportune time, and I want to call on all Kenyans to support these governors, to support the enforcement, and to ensure that the education is complemented, because this is a societal issue which we all must deal with, corruption.
But why are you saying we deport people? Are you suggesting that without those people, there are no Kenyans involved in this business?
I think deportation is one thing.
One thing, yeah.
Yes,
I
agree. So
they are known.
Yeah.
In Mombasa, we know them. They are people who are known but protected. And now, a natural fact, at one time, the late Akasha, who was killed in Amsterdam, people knew he was a drug dealer. He was very well known. And who finished after he was killed? Who finished his systems? His systems, infrastructure, was it ruined after his death?
Yeah, but I think that's this very valid questions that you are raising, and I would share completely. What I am optimistic about, and what I would like Kenyans to be optimistic about, is that we now have a real opportunity. We have a chance that we have a political government, administration of His Excellency the President, that is determined to address this matter. I also want to say that if you look at the coast, for example, where we really have the greatest of these problems, and Nairobi, both the governor